Good evening, everyone. I'm audible, guys. Yes, so good evening, everyone. Welcome to the session, part two of previous year questions and topics of PSM. So we are done with part one yesterday. I hope you have revised this session as well. And if you have any doubts regarding the previous session, you guys can ask. Okay, so let's begin with the part two of previous year questions. Okay, so we are done till vitamins. Yes, so can we begin? Just confirm in the comment section once. I'm audible and visible to all of you. Yes. Okay. Thank you. Thank you. So let's begin with the session, guys. Question number one. There is a group of 200 hypertensive patients. For first group of 100 patients follow medical advice, whereas the second group of 100 patients follow the lifestyle advice. There is a test for both the groups after the 3 months. Which of the following is the best test for significance to compare the blood pressure levels in both the groups? So comment down your answers, guys. What can be the answer for the particular question? This is the question from the test of significance. So we have a different types of tests depending upon whether the data is quantitative or a qualitative. Then further we'll check how many groups are there, and further we'll get to know what kind of test exactly we use in this. So write down your answers. So if I talk about, we have two types of data. We have how many types of data, guys? We have two types of data. One is quantitative, another is qualitative. One is quantitative, another one is qualitative. What is quantitative data? Quantitative data means the data that we can measure. For example, blood pressure, okay, HB levels, cholesterol levels. This is a type of a data that we can measure, and such type of data is called as quantitative data. And for quantitative data that we can measure, the tests we have are for a quantitative data are parametric tests. For quantitative data, and the data that we cannot measure, for example, anemia. In anemia, can we measure the anemia? No, we can just know the types of anemia. Okay, for that we use non-parametric tests, that is qualitative. So whenever such questions are coming up, first differentiate whether the data is quantitative or qualitative. Okay, now in parametric tests, guys, we have two types of tests. Number one, that is student t test. Number one is student t test. In student t test, guys, we have two types. Either it can be paired or unpaired. Either we have paired student t test, or we have unpaired. Now, if before the intervention and after the intervention we have a same group, that goes with the paired student test. For example, just take an example, guys. You have 10 people, okay, having a cholesterol levels of 300. So in these 10 people, you are starting a statins, hypolipidemics, for example, rosuvastatin. Okay, now before starting the drug therapy, I'm checking the blood cholesterol levels in these 10 patients, and after starting a hypolipidemic, I'm again checking the cholesterol levels in the same 10 people. That means before the intervention and after the intervention, there is the same group. At that time, the test that you are going to use is paired student test. At that time, the test you are going to use is paired student test. Okay, so can I say that paired student test is for one group? Yes, so for one group, it's paired student test. That means before and after the intervention, we have a same group. If I talk about unpaired student test, my dear students, unpaired student means when before and after intervention, there are two different groups. At that time, your answer goes to At that time, your answer goes to unpaired student test. Unpaired student test. Now, if you have more than two groups, if you have more than two groups, at that time, the test we do for a quantitative data is ANOVA test. Okay, what is ANOVA test? For more than two groups. For more than two groups. So let's discuss this question, guys. The best test of significance for the blood pressure. So blood pressure is a quantitative or a qualitative data? Write down in the comment section. Blood pressure will be quantitative or qualitative data? It will be quantitative data that can be measured. So what type of the test is done? So which of the following test will be done, guys? Paired, unpaired, or ANOVA test? Now, if we look in the question, guys, there were two groups. Okay, one who are taking the treatment, another one changing the lifestyle. Okay, so before and after intervention, we are comparing it between the two groups. And then what will be the answer? Write down in the comment section. What will be the answer, guys? Yes? What will be the answer? Write down. You have a quantitative data. You have two different groups. Okay, one is following a medical advice, another is following a lifestyle change. So which type of test will be done? Correct? Yes, it will be unpaired student t-test. It will be unpaired student t-test. Okay, if before an intervention and after the intervention you have same group, then your answer goes to paired student t-test. Paired student t-test. And if in case there are three people, okay, if in case there are three people, A, B and C, and we are starting the antihypertensive, so what will be the answer for three different groups? What will be the answer for three different groups? And you're checking the blood pressure after the antihypertensive therapy, then your answer goes to, at that time it will be ANOVA test, because blood pressure is a quantitative and the test of significance for more than two groups, your answer is going to be ANOVA test. So always remember, guys, in quantitative data, in parametric tests, we check usually mean and standard deviation. So if in the question they are mentioning that mean and standard deviation has to be calculated, then your idea goes to it is a parametric test. And in parametric test, it can be three. It can be either paired, it can be unpaired, or it can be ANOVA. Okay, now non-parametric tests for a data that cannot be measured. For example, the type of anemia you have. Okay, in such type of questions, the examiner will mention about percentage and proportion should be calculated. Percentage or proportion. And for such type of data, if it's one paired group, for such type of data, if it's one paired group, your answer goes to sign test. Your answer will be sign test for one paired group. For one paired group. And the second one will be chi-square test. And when you will mark chi-square test, when there are two unpaired groups or more than two groups. Two unpaired or more than two groups. So for such questions, guys, for such questions, always remember to differentiate first whether the data is qualitative or a quantitative. Followed by that, check the groups. If there is a one same group before an intervention and after the intervention, your paired student test. If it's different, unpaired student test. If it's more than two groups, ANOVA test. For non-parametric, the same way you will answer, guys. If it's one paired group for a qualitative data, your answer is going to be sign test. If two unpaired, chi-square, more than two groups, your answer is going to be again chi-square test. So for this question, unpaired student t-test. So remember this, okay? Very important question, guys. This question they will ask. Remember this table so that you can solve easily these questions. Which of the following are included in NPC DS? NPC DS means National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. Okay, so your answer is going to be, write down in the comment section what will be the answer for this question. What will be your answer for this question? Write it down. Yes, it's D, right? It's cardiovascular disease, cancer, diabetes, and stroke. Okay, these are the diseases that are included. Asthma is not included. So in above three options, asthma is given. Asthma is not in the NPCDS. Okay, so a bit change in NPCDS, guys. Before, this is the logo for the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. But now on 5th of May 2023, okay, the name has been changed. Name changed to, the new name is NPNCDS. NPNCDS. That means National Program for, remember the new name, National Program for Prevention of Non-Communicable Diseases. Non-communicable diseases. So what is the answer for this, guys? D, cardiovascular disease, cancer, diabetes, and stroke. But remember the new name as well, guys. NPNCDS, National Program for Prevention of Non-Communicable Diseases. Next question, guys. Minimal antenatal visits required are, how many antenatal visits are required, guys? Minimum 3, 4, 5, 6. The question is just mentioning minimal antenatal visits. Okay, what will be your answer? Comment down your answers. Comment down your answer so that you can remember. PDF in the end I will share and you can revise them from the PDF. Okay, what will be the answer, guys? Yes, minimum antenatal visits required are 4. Minimal antenatal visits required are 4. Okay, now if I talk about how many antenatal visits are required, guys, mainly 13 to 14 visits are advisable. How many visits? 13 to 14 visits are advisable. Now if we talk about 0 to 7 month, from first 7 months, how many visits? Once per month. Once per month. Second, if I talk about 8th month, 2 in a month. And if I talk about 9th month, once per week. Once per week. So remember these 0 to 7, once per month. In an 8th month, twice. In a 9th month, once per week. Okay, and minimum antenatal visits. Minimum antenatal visits. How many minimal should be there, guys? 4. But as per WHO, it is 8. So remember, if the question mentions as per WHO, your answer is going to be 8. If directly asking minimum antenatal visits, then your answer is going to be 4. 13 to 14 visits are advisable. So your answer is for this question is 4. Okay, let's move to the next question. A man came for the checkup after his father had a cerebrovascular accident due to the hypertension. Okay, so a patient is coming for a screening, okay, for the simple checkup. What type of prevention is this? So can you answer me in the comment section, guys? It is primary, primordial, secondary, or tertiary? Yes, write down in the comment section. What will be the answer, guys? Primordial, primary, secondary, or specific protection? Yes, most of you are right. Good. So let's discuss this topic, guys. If I talk about a pathogenesis of the disease, we have two phases. We have pre-pathogenesis. We have pre-pathogenic phase. And my dear students, we have pre-pathogenic and we have pathogenic phase. Before the disease and after the disease, or during the disease. Okay, if I talk about pre-pathogenic, before pathogenesis, okay, before the disease, we have two preventions. Either we go for primordial, and the second one will be primary. Primordial and primary. So in pre-pathogenic phase, we have primordial and primary. And if I talk about in a pathogenic phase, we have early secondary, and we have late tertiary. We have early secondary and we have late tertiary. Okay, so two phases. First, pre-pathogenic phase. In pre-pathogenic phase, what you will remember mainly, guys? Primordial and primary. Primordial and primary. And in pathogenic phase, you will remember early secondary and late tertiary. Okay, now what do I mean by the primordial type of prevention, guys? Write it down. The prevention of occurrence of risk factor. So what is primary prevention? When you stop, sorry, if I talk about primordial prevention, what do I mean by primordial prevention? It means prevention of occurrence of the risk factor. Occurrence of a risk factor. For example, guys, if we are changing the water of a cooler every 3 days or every week, what will happen? The mosquitoes will not happen. So mosquitoes will not come. So changing the water of a cooler every 3 days is a which level of prevention? Primordial level of prevention. Now, my dear students, already mosquitoes are there. Now you're using the mosquito net to prevent yourself. Okay, that will be what type of prevention? That will be a primary level of prevention. So what do I mean by now primary level of prevention? You are stopping prevention of disease in presence of a risk factor. So you are preventing the disease and the risk factor is present. So right now mosquitoes are there. Okay, so mosquitoes are there, risk factor for malaria. Okay, but you're using a mosquito nets for the prevention. That goes with the which level of prevention? That goes with the primary level of prevention. So write it down. Prevention of disease in presence of risk factor. Okay, all the vaccines are which level of prevention, guys? All the vaccines are primary level of prevention. All the vaccines are which level of prevention? All the vaccines are primary level of prevention. Primary level of prevention. Then third one, secondary level of prevention. Secondary level of prevention. In secondary level of prevention, I mean by early detection and treatment. So all the diagnostic tests that we are doing, all the screening tests that we are doing, that falls under which level of prevention? That falls under secondary level of prevention. So write it down, guys. Early detection and treatment. Early detection and treatment. Okay, then the last one goes to tertiary. And what do I mean by tertiary level of prevention, guys? By tertiary level, I mean the management of complications and disability. So you managing the complications like spectacles or clutches in the polio, that all goes to tertiary level of prevention. Management of complications and disability. Management of complications and disability, that goes to the tertiary level of prevention. So what is the primary level of prevention, guys? Primordial first, prevention of occurrence of the risk factor. You are stopping the risk factor to occur. Then primary means prevention of disease in presence of the risk factor. Then the third one, guys, secondary, early detection and the treatment. And last one, tertiary, management of the complications and disability. So all the vaccines, okay, so all the vaccines are which level of prevention? They are a primary level of prevention. Okay, all the diagnostic tests are which level of prevention? Secondary level of prevention. So remember that. Now if a question is mentioning BCG vaccine used in bladder cancer, that will be which level of prevention? Okay, now if a question is mentioning that a patient is using BCG vaccine for the bladder cancer, Now at that time BCG vaccine will be which level of prevention? At that time BCG level will be secondary level of prevention. At that time BCG vaccine will be secondary level of prevention, because I'm using BCG vaccine that time for a Homo sapien. How can that be a tertiary? That will be secondary. Tertiary is after the complications and disability. So all the treatment will be considered as okay. Now my question to you guys. Okay. Now tell me guys, a patient is HIV positive. A patient is an HIV positive. For pneumocystic gyrovasy pneumonia, I'm using prophylactic drug cotrimoxazole. Using cotrimoxazole is a which level of prevention? I'm again repeating the question guys. A patient is HIV positive patient is there, okay? And you know HIV positive patients are more prone to the opportunistic infection depending upon the CD4 count. Now I'm telling you CD4 count is less than 200. That means patient will more prone to which type of opportunistic infection? Pneumocystic gyrovasy pneumonia, okay? Now I'm telling you that we started prophylactic treatment of, we started the prophylactic drug of cotrimoxazole, because what is the drug of choice for pneumocystic gyrovasy? It is cotrimoxazole. So using cotrimoxazole in a HIV positive patient is a which level of prevention? Cotrimoxazole in pneumocystic gyrovasy pneumonia, okay? Prophylactic drug is a which level of prevention guys? I'm telling you prophylactic. What do I mean by prophylaxis? When you give treatment before a particular disease, you want to stop that disease to occur, but risk factor is present. So HIV is there, patient is immunocompromised. So I'm saying that patient of an HIV has more chances of an opportunistic infection. Understand the question. He has more chances of opportunistic infection. Currently he is not having pneumocystic gyrovasy, but you are using a prophylactic treatment, okay? You are using a prophylactic drug that will go to which type of prevention guys? Risk factor is present, disease is absent. So you prevent the disease in presence of a risk factor. All you guys correct your answer. हाँ जी, yes, बता दो. That will be a primary level of prevention, yes, because you are using it for prophylaxis. If I'm saying patient is already having pneumocystic gyrovasy pneumonia, okay, by having perihilar opacities in the chest x-ray, then you know disease is present. Now you are giving a treatment, that will be then a secondary level of prevention. But I'm saying I'm using a drug for prophylaxis में दे रहा हूँ क्योंकि पेशेंट को pneumocystic gyrovasy pneumonia नहीं होना चाहिए, because there are more chances of that infection when the CD4 count is less than 200. So your answer is going to be a primary level of prevention. Is that clear? So remember guys, prophylactic treatment is a primary level of prevention, but if the disease is present at that time, it is going to be a secondary level of prevention. Okay, now tell me guys, patient is going for a mammography. So mammography is which level of prevention? Mammography will be which level of prevention guys? Mammography will be a secondary level of prevention. And here as well, remember guys that here as well, so it will be a secondary level of prevention. Checking a blood pressure will be a secondary level of prevention. Again guys, level of prevention is a very important question. Test of significance is a very important question. Some questions will be clear cut from the PSM guys. Some questions will be opinion based. You cannot find them in the notes, but some questions will be there. Okay, so keep revising such questions. So mid-year population is taken on. Tell me the answer guys. Very simple. Mid-year population is taken on. I've already discussed yesterday on July 1st. Mid-year population is taken on July 1st. Okay. Next question guys, is this clear? Mid-year population, very simple one, 1st of July. Now which of the following is an indicative of severity of or a lethality of disease? Okay, severity of disease is calculated by proportion mortality rate, case specific death rate, case fatality rate, or total deaths due to that disease. What will be your answer for this question guys? Write down in the comment section. which of the following will tell us about a severity of the disease, or which of the following is going to tell us about a killing power of a disease or a virulence power of an organism? The question can be framed in 3 different languages. That is, what will be your answer? Yes, correct. You are right. It's case fatality rate. It will be case fatality rate. Okay, so let me discuss what do I mean by CFR. Okay, so let's discuss, guys, case fatality rate. So what do I mean by case fatality rate? It tells us about a disease severity. So it's a measure of disease severity. Okay, number 1. Okay, it tells us about the virulence power of organism. It tells us about virulence power of organism. Or it tells us about a killing power of a disease. It tells us about a killing power of disease. Which disease has a case fatality rate? Which disease has a CFR of 100%, my dear students? Remember, rabies, having a case fatality rate of 100%. Rabies having a case fatality of 100%. If I talk about Japanese encephalitis, it's around 30%. Okay, rabies with 100%. Now, how do you measure this case fatality rate, guys? Remember, it is measured number of deaths from a disease over a defined period upon population at risk during that time. Just correct it one. It number of deaths from a disease upon number of individuals diagnosed with the disease multiplied by 100. So that tells us about a case fatality rate. So remember, guys, which disease have a CFR of 100%? That goes with the rabies. So what is the WHO definition of the blindness? Yesterday we have discussed in the part 1 question. Okay, what is a WHO definition of a blindness? Tell me what will be the answer for this question, guys. WHO definition of blindness. WHO definition of blindness. Write down the answer. WHO definition of a blindness. Answer is, write down in the comment section, guys. A, B, C or D. Good, correct. It's less than 3/60 in the better eye. Very good, Hari and Raz. It's less than 3/60 in the better eye. Now tell me, guys, if a patient is having a vision of less than 3/60, as per the old classification, it is which type of blindness? As per the old classification, less than 3/60. As per the new classification, you already know that anything less than 3/60 goes with the blindness. Okay, before that we have normal vision, we have moderate visual impairment or a mild visual impairment, or the severe, then goes to the blindness. Now as per the old classification, less than 3/60 goes with the, write down in the comment section, guys, again the PYQ. This question is again a PYQ. Less than 3/60, it goes with the social blindness. It goes with social blindness. Okay, less than 6/60 goes with economic blindness. These are 2 PYQs that we have discussed yesterday as well. Okay, so remember this: social blindness and economic, as per the old classification. But as per the new classification, any value less than 3/60, your answer is going to be blindness. Let's have a quick revision of that particular table so that you will remember. Okay, chalo. Here is the table, guys, that we have discussed yesterday. Okay, so new classification, guys, 6/6 to 6/18, normal vision. then followed by that there will be a mild visual impairment and severe visual impairment. Okay, and any value less than 3/60, your answer is going to be a blindness. Your answer is going to be a blindness. Okay, as per the old classification, less than 3/60 to 1/60, your answer is going to be social blindness, and if less than 6/60 to 3/60, your answer is going to be a economic blindness, and further if less than 1/60, manifest blindness, and less than the perception of the light, your answer is going to be an absolute blindness. So remember that. Again, the question was, what is an WHO definition, guys? Vision less than 3/60 in the better eye. So vision less than 3/60 in the better eye with the best possible correction, Okay, then the global diseases under that, and in India we have already discussed yesterday. Chalo, next question. In a train accident, there were 74 dead, 4 were severely injured, 20 moderately injured, and 32 mild injured. Color coding in a triage, highest to lowest category is. So arrange them from the highest to lowest category, guys. So what will be your answer? A, B, C, or D? What will be your answer for this particular question? A, B, C, or D? A, B, C, or D? Yes, correct. It's red, yellow, green, black. The answer is D, red, yellow, green, black. Okay, so let's discuss about a triage, guys. It's segregation of the patient based on the chances of survival. Okay, it's segregation of patient. It's segregation of patient based on chances of survival. Based on chances of survival. Okay, you don't need to write these things, guys. I will share the PDF. All you can do is comment down the answers. Test your knowledge, how much you can recall this time. Okay, this is not the time to write things. This is time to recall. Okay, so you guys recall and answer in the comment section. Later get the PDF and revise the PDF. कौन सी बड़ी बात है? But right now we are just 28 days away from the exam. So right now it's better to what? Answer and recall your concepts. Answer and recall your information, because PSM is all about what? PSM is not, you will make concepts here. PSM is not understanding about concepts. It's just to remember. Ratta lagane wali cheez hai na. You have to remember. You cannot change that. Okay, you have to remember the formula of a CFR. You cannot change. You have to remember the value of maternal mortality rate. You cannot change that. So right now, all these sessions that are being conducting, these sessions are meant to recall your information, not to study. Padne wala time gaya. Okay, right now it's a revision time and recalling time. Solve the questions, mock tests, watch these rapid revisions, keep answering so that you will recall this in the exams. ठीक है ना? So at the end you get the PDF, you message me, I'll share the PDF, have a quick revision of the PDF at that time. Right now just recall the information that you have studied from your primary notes and your main classes. Chalo, so there are 4 groups. First of all, you have red color. Okay, in red color we are giving a highest priority. So red color we are giving a highest priority. Okay, for red color we are doing a life-saving surgeries. Those who need an immediate resuscitation, life-saving surgery, need immediate resuscitation in 0 to 6 hours. In 0 to 6 hours. Yes, I am trying to motivate as well. You guys focus, you guys answer, motivation khud se aa jayega. You guys focus, you guys recall, you will get motivation by yourself. Okay, and I'll be giving as well. But for now, guys, yellow color has been given a medium priority. So right, for yellow color we are giving a medium priority. These are all the repeated main important topics. Okay, medium priority. So those people which are categorized under the yellow color, they also need a surgery, but the time gap, it's 6 to 24 hours. 6 to 24 hours. If I talk about green color, guys, green color has been given a low priority. Green color के लिए क्या मिलती है? Low priority. So for green color there is low priority. Okay, and these are the patients having a minor injuries. These are the patient having minor injuries, or ambulatory patients, or ambulatory patients. Okay, and the last one, guys, black, these are the dead or about to die. Black color triage for the people who are dead or about to die, moribund. Okay, so what will be your, from highest to lowest, what will be the order? Red, yellow, green and black. Red, yellow, green and black. So remember, sometimes the examiner can play, they will write lowest to highest. Okay, so remember, highest to lowest, red, yellow, green, black, and lowest to highest, black, green, yellow and red. Black, green, yellow and red. Okay, let's move to the next question, guys. A healthy person got in contact with an infected case and they have to separate him not for more than the incubation period of the disease. So what will be your answer, guys? So a healthy person has been separated and with an infected case, and they have to separate him for not more than the incubation period. So what will be your answer for that, guys? When we are separation of unhealthy people till the maximum incubation period of the disease, your answer is going to be what? Write down the answer in the comment section, guys. Separation of an apparent healthy person till the maximum incubation period, your answer is going to be a quarantine. So it's absolute quarantine. So we have two definitions here, remember. One is quarantine, another is isolation. Another one is isolation. Okay, so what do I mean by quarantine? Write it down, guys. It's a separation of, it's the separation of apparent healthy people, separation of apparent healthy people till maximum incubation period, till maximum incubation period. So your answer goes to quarantine. So when a healthy person has been separated till the maximum incubation period is called as quarantine. For example, guys, in COVID-19 incubation period was 14 days. So we are keeping a person separated till 14 days incubation period. What is isolation, guys? It's a separation of diseased person. In isolation, patient is already confirmed with a disease, so it's a separation of diseased person. Separation of diseased person till the period of communicability, till the period of communicability is called as isolation. For example, measles. What is a POC of measles, guys? 4 days before the rash, 4 days after the rash. Some books write 4 days before the rash, 5 days after the rash. So classical difference, guys. Quarantine means when you separate a apparent healthy person till the maximum incubation period. And what do I mean by isolation? It means when you separate a diseased person till the period of communicability. Okay, POC. Chalo, that is absolute quarantine. Okay. Now, a male underwent a vasectomy and after 3 months, his wife got pregnant. Okay, a patient went to the permanent surgical methods for contraception, guys. Vasectomy. What advice should have been given to him post vasectomy? So after the vasectomy, guys, what is the advice that we've been giving to the patient, guys? Write it down in the comment section. What will be the advice? What will be the advice given? Again, the एयरपोर्ट पे फिर आइसोलेट क्यों किया था हेल्दी इंडिविजुअल्स को? what exactly is in the books is never followed. So when you work, hopefully when you will all pass the exam, whatever you will study in the books is not followed. Every single thing is not followed in the hospitals. Okay, so remember that. Chalo, guys, Draz. So what is the answer, guys? Yes, use a barrier method for 3 months after the procedure. Very good. And what other advice? After the 20 ejaculations, then after 20 ejaculations, then you can use there are no chances of being pregnant. Okay, so vasectomy, one more question I will add here, guys. After vasectomy, most common cause of failure of vasectomy. What is the most common cause of failure of vasectomy, guys? It's a neat PG PYQ. Most common cause of failure of vasectomy. Your answer is going to be misidentification of vas. Misidentification of vas. Okay, so remember that most common cause of failure of vasectomy is misidentification of vas. And for vasectomy, if I talk about ASI Act, how many days of leave is given for the vasectomy? Write down in the comment section, guys. As per the ASI Act, how many days of leave has been given to a patient going for vasectomy, guys? It is 7 days. And for tubectomy, it is 14 days. And most common cause of failure is misidentification of vas. And most common procedure for the tubectomy is Pomeroy's technique. Pomeroy's technique, remember that as well. A child reported to the primary health center with a runny nose, fever since last 3 days. Rash started on a face and then covered the trunk part of the body. What's the likely diagnosis? So you have a patient, guys, complaining of a child complaining of cough, coryza and conjunctivitis. Conjunctivitis I'm not mentioned. So cough, coryza and conjunctivitis, 3 C's. Your answer is going to be write down in the comment section, guys. Yes, your answer is going to be measles. Very good. Your answer is going to be measles. Okay. Every time paper without a measles is incomplete. All the exams you've been checked, either they ask the period of communicability of the measles, either they will give 3 symptom and diagnose, either they will give the vaccine strain, either they ask the complication of the measles. So measles is very important. Okay, so if I talk about measles, guys, if I talk about an agent of measles, let's talk about agent of measles, RNA paramyxovirus. What is agent of measles, guys? RNA paramyxovirus. RNA paramyxovirus. RNA paramyxovirus. If I talk about incubation period, guys, 10 to 14 days is the incubation period. And remember, measles are also called as a rubiola. In options, they can mention also rubiola. Okay, what is the period of communicability, guys? 4 days. 4 days before the rash. R I'm circling, that means before the rash, and 5 days after the rash. And 5 days after the rash. So you remember measles with 45. Chicken pox को अगर याद रखना होगा, CP. It's not cannot place, it's chicken pox. Chicken pox को 25. 2 days before the rash, 5 days after the rash. 2 days before the rash and 5 days after the rash. Period of communicability. Remember about these 2 diseases. So 3 C's of measles we have, guys. We have cough, we have coryza and conjunctivitis. We have cough, coryza and conjunctivitis as 3 C's of measles. Famous 3 C's of asthma. Can you write down in the comment section, guys? 3 C's of asthma. Again an important question, guys, from Patho. 3 C's of asthma. We have Crayola bodies. You have Crayola bodies. We have Crushman spirals. And one more, we have Charcot Leydig cells. Remember that as well, Charcot Leydig cells. So these 3 C's of asthma are very important. Okay, and 3 C's of a measles, cough, coryza and conjunctivitis. Then, guys, bluish white spot on the red base of buccal mucosa opposite to the second molar teeth. What are the classical spots called as? Koplik spots. These spots are called as Koplik spots. These spots are called as Koplik spots. And you have a hyperpigmented line on conjunctiva called as Stimson's line. Called as Stimson's line. Okay, now what are the common complications? If I talk about most common complication of the measles, most common complication of the measles, you have otitis media. You have otitis media. Other complications such as patient can also have pneumonia. Patient can also have diarrhea. Okay, these are all the complications of pneumonia. But we have a classical, very rare complication called as subsclerosing panencephalitis. Subsclerosing panencephalitis. So write it down. Subacute sclerosing panencephalitis. Panencephalitis. Okay, the vitamin deficiency that is associated with the patient having measles is vitamin A. Is vitamin A. And what is the name of the vaccine strain? It's Edmonstron Zagreb. It's Edmonstron Zagreb. And we have a supportive treatment will be given, and WHO measles elimination strategy was catch up, keep up and follow up. Catch up, keep up and follow up. So this is all about measles. One more question guys from pathology. What is the giant cell of measles called as? Write down in the comment section. Giant cell of measles. Giant cell of measles started with the W. Yes, I'm already giving a hint. Give me the answer. Giant cell of measles is called as. Giant cell of measles is called as. Wathan Finkeldy giant cell. Okay, remember all these giant cells guys. For TB we have Langhans giant cell, है ना? So remember these cells as well. So remember for the measles we have Wathan Finkeldy giant cell. Okay, so that was all about measles, cough, coryza, conjunctivitis. Very good. Okay, then rubella guys and mumps we have already discussed. Rubella we have already discussed guys. In rubella we have classical blueberry muffin rash. Blueberry muffin rash in rubella. And congenital rubella we have a triad called as CCD. C for cataract, C for congenital heart defect, congenital heart defect, and D for deafness, SNHL. So remember cafe coffee day, CCD. Most common cardiac defect associated with rubella is patent ductus arteriosus. It will be patent ductus arteriosus. So write it down guys. If you're so next question guys. So what is the answer for this guys? Measles. So remember guys, most common complication. Remember most common complication. Remember rare complication, vitamin deficiency and Koplik spots as well. Okay, and period of communicability was asked January 2023 exams. If next question, if you're posted as a medical officer in an area under NVBDCP, okay, National Vector-Borne Disease Control Program, NVBDCP, and under this program we have multiple disease like filariasis, leishmaniasis, malaria, chikungunya, dengue, Japanese encephalitis. Okay, so all these diseases you have to remember guys that are coming under this program. And you will be advised to spray a malathion for a malaria prophylaxis. I've told already guys, this malaria also comes under this. What could be the probable diagnosis you will take regarding frequency of the malathion spray? So what is the answer for this question guys? What will be the frequency guys? Once every fortnight, once every 15 days, once every 3 months, twice every 3 months, or once every month? What will be your answer guys? As malathion, it's the least organophosphate. It's a least toxic organophosphate, and spray is done with a concentration of 100 to 200 mg feet per square. And your answer is going to be very good. It will be once every 3 months. Again a PYQ good. DRAS 33, once every 3 months. Once every 3 months. Okay. For other conditions we usually go for DDT as well. Okay, in case of leishmaniasis, because the vector is sandfly or phlebotomous fly, we go for dichloro, diphenyl, trichloroethane. Okay, a country is suspecting a severe disease. What is the probable time within which one should report it to the WHO? So what should be the probable time guys that you have to report the particular disease to the WHO guys? How many hours? Yes, correct, it is 24 hours. Okay, so the country can take 48 hours to assess the condition, but they have to report it within 24 hours for severe disease. For example, anthrax. All the severe disease you have to report to the WHO within 24 hours. You can assess it in 48 hours, but reporting should be 24 hours. A nurse spill blood on the floor. What can be used to disinfect it? Yes, for a blood spillage, to disinfect it, what we will use? Cresol, ethyl alcohol, glyceraldehyde, or 1% sodium hypochlorite. Okay, so remember guys, your answer is, if it is a small blood spill, if it is a small blood spill, your answer is going to be 1% sodium hypochlorite. 1% sodium hypochlorite. If it's a big spill, if it is a big spill, then your answer is going to be 10% sodium hypochlorite. Then your answer is going to be 10% sodium hypochlorite. So your answer here is 1% sodium hypochlorite. Your answer here is 1% sodium hypochlorite. Okay, next question guys. A drug of choice for chemoprophylaxis to the healthcare personnel and the close contacts of confirmed case of pandemic influenza A H1N1. So what will be your prophylactic drug, or what will be a drug of choice for influenza A? What will be your answer, my dear students? What will be your answer for influenza drug of choice? Influenza drug of choice. What will be your answer? Yes, very important guys. Ribavirin, oseltamivir, or zanamivir. Your answer is going to be oseltamivir. Very good. Your answer is going to be oseltamivir. Okay. If I talk about zanamivir, guys, zanamivir is also used. Zanamivir is also used, but is a nasal drug. It is used nasal drug. Okay, it's a nasal drug. Oseltamivir is an oral drug. Okay, for influenza. Okay, we have a IV drug as well called as paramavir. Called as paramavir, used IV. Now ribavirin is an aerosol drug. Again, it is used for a RSV. RSV is causing bronchiolitis, and for bronchiolitis, the drug of choice is ribavirin for bronchiolitis caused by RSV. I'm integrating it a bit. RSV cause करता है, we use ribavirin. Okay, so all these drugs, remember ribavirin used in bronchiolitis caused by RSV. We have a classical cells called as Clara cells in bronchiolitis. Clara cells in bronchiolitis. Now, NEET PG question was asked that what is a mechanism of action of a drug oseltamivir? It is neuroaminidase inhibitor. It's neuroaminidase inhibitor. Remember that it inhibits neuroaminidase enzyme, neuroaminidase inhibitor. Now if I talk about an agent causing influenza, let's discuss a little bit about influenza guys. If I talk about agent causing influenza, what is the virus? It's caused by orthomyxovirus. What is the name of the virus, my dear students? It's orthomyxovirus. If I talk about incubation period guys, incubation period is about 72 hours or 2 to 3 days. The incubation period is 2 to 3 days. Then we have types of influenza: type A, type B, and type C. Type A H1N1 that I have mentioned guys. Then we have Victoria as type B. Then we have H5N1 as bird flu. H5N1 as bird flu. Okay, and one more question on the influenza was asked: which of the following disease, or which of the following infections, or which of the following vaccine strain is changed every year? So due to the genetic shift or the mutation, antigenic variation, influenza change strain every single year. So drug of choice is going to be oseltamivir. If the question is which of the following is a nasal drug for the influenza, your answer is going to be zanamivir. If the question is which of the following is an injectable drug for an influenza, your answer is going to be a paramavir. Your answer is going to be a paramavir. Okay, oseltamivir comes with a trade name Tamiflu. क्या आता है trade name guys? Tamiflu. चलो next question. Mechanism of action, please remember this guys. This is the question asked. Is this much clear guys? Influenza is clear to everyone? Influenza is clear? Yes. Chalo. Kala-azar. Kala-azar is transmitted by, also called as leishmaniasis. Now who is going for the survey of leishmaniasis? Your answer is, leishmaniasis के लिए कौन जाता है? आशा. for an active surveillance of leishmaniasis. So write down, guys. Kala-azar is transmitted by. Kala-azar is transmitted by redwood bug, sandfly, CC fly, or mosquito. Very good. Your answer is going to be sandfly. Your answer is going to be sandfly. So let's discuss everything about a leishmaniasis, guys, from micro as well. Microbiome se bhi clear ho jayega, and from the PSM point of view, we'll get this disease done. If I talk about agent of leishmaniasis, guys, we have three agents: Leishmania donovani, and this Leishmania donovani will cause a visceral leishmaniasis. It will cause visceral leishmaniasis. If I talk about Leishmania tropica, L tropica, it will cause cutaneous leishmaniasis. It will cause cutaneous leishmaniasis. If I talk about L brasiliensis, if I talk about L brasiliensis, it will cause mucocutaneous leishmaniasis. It will cause mucocutaneous leishmaniasis. What is the vector, guys? That was the question asked. The vector is sand fly, also called as phlebotomous fly, which is also called as phlebotomous fly. Okay, reservoir. What are the reservoir, guys? Wild animals. Wild animals. Now, diagnosis of leishmaniasis. So about the diagnosis, guys, remember we have a first test that we do, the initial test for diagnosis. Very important, RK39 dipstick test. So we have RK39 dipstick test, and this is an initial test for diagnosis. That is an initial test for diagnosis. That's the initial test for diagnosis. And what exactly this test is, guys? There is an antibody detection. There is an antibody detection in urine and blood. Urine and blood. Then the second, guys, we have intracytoplasmic inclusion bodies, which is a confirmatory test for the leishmaniasis. What are these bodies called as? LD bodies. What are these bodies exactly, guys? They are LD bodies. Leishmania donovani bodies. We have Leishmania donovani bodies. These are intracytoplasmic inclusion bodies. These are intracytoplasmic inclusion bodies, and they are confirmatory tests. Confirmatory test. We also go for Leishmania test, guys, but that is not a diagnostic test. Leishmania test, which is not a diagnostic test, it will just tell me about immune status of the patient. It will tell us about immune status of patient. Okay, and remember, it's not for diagnosis. It's not for diagnosis. If I talk about drug of choice, your drug of choice is going to be L-amphotericin B. Your drug of choice is going to be LAM, and same drug L-amphotericin B, liposomal amphotericin B, is a drug of choice for severe fungal infections like mucormycosis, Kala-azar, and cryptococcal meningitis. And if you want to control this insecticide, if you want to control the vector, use an insecticide, diphenyl trichloroethane, DDT. So remember everything about leishmaniasis, guys. Very important, guys. Remember RK39 dipstick test. Who is going for the surveillance? Asha is going for the surveillance, guys. It's mainly found in कहाँ होगा? Question में hint दिया होगा West Bengal, Bihar. West Bengal, Bihar will be the hint. So that's all about a Kala-azar and leishmaniasis. Is this clear, guys? So your answer here, sand fly. Your answer is going to be sand fly. Clear? Yes? Next question. Chalo. Very good. In which category of a bioterrorism anthrax belong? Okay, anthrax belong to which category of bioterrorism? Which category of bioterrorism? So A for anthrax, A for category A. Again, ask last FMG exams. So not last, before that. Okay, anthrax belongs to category A. So bioterrorism, we have three categories. Category A having highest mortality or high mortality. These diseases have high mortality. High mortality. For example, anthrax, most common. Okay, second one will be plague, second most common. Followed by that, we can have botulism. It's very lethal because of the toxin. Okay, then we can have smallpox. Then we can have tularemia, and viral hemorrhagic fever. Viral hemorrhagic fever. Okay, so anthrax, plague, botulism, smallpox, tularemia, and viral hemorrhagic fever. If I talk about category B, we have brucellosis. We have brucellosis. We have Q fever. We have Q fever. We have Clostridium perfringens. We have Clostridium perfringens. We have epidemic typhus. We have epidemic typhus, and we have viral meningitis and viral meningitis. That all goes with the category B. B for brucellosis, Q fever, Clostridium perfringens, epidemic typhus, and viral meningitis. Okay, and in category C we have coronavirus and Nipah virus. Coronavirus and Nipah virus. So remember guys, all categories. Okay, now can you, any one of you, answer me what are the two classical tests we do for brucellosis? Two classical tests for brucellosis. Anyone in the comment section, guys? What are the tests that we do for brucellosis? Yes, two tests that we do for brucellosis. Brucellosis के लिए क्या टेस्ट करते हैं हम? Comment down faster. For brucellosis, what exactly is the test? Yes, it is Rose Bengal test. It's Rose Bengal test or a milk ring test. So Rose Bengal test or the milk ring test. Rose Bengal test or the milk ring test. It is done for brucellosis. It is done for brucellosis. Chalo guys. What is the drug of choice for viral meningitis? Your drug of choice for viral meningitis is acyclovir. Acyclovir. Remember all these things, guys. Chalo, next question. Which type of cancer won't be affected in a patient of using OCP? So which type of cancer won't be affected if a patient is using OCP, or which is a protective factor for? Okay, so OCPs are a protective factor for. OCP decrease which cancer risk? So write it down, guys, in the comment section. Write down the answer for the next question. OCPs decrease which cancer? OCPs is a protective factor for which cancer? Write down in the comment section, guys. OCPs are a protective factor for which cancer? Yes. OCPs are a protective factor for which cancer? OCP will increase, Sheen, OCP will increase the breast cancer. It's a protective factor for which cancer? Cervical cancer भी तो कराते हैं. OCP causes cervical cancer. A or B? It is A, Hari. It is A. So OCP is a protective factor for endometrial cancer. Okay. Okay, hepatic, breast and cervical cancer, guys, they increase the chances of which? They increase the chances of cervical cancer, breast cancer and hepatic cancer. And they decrease which cancer? Endometrial cancer. They decrease ovarian cancer and uterine cancer. So let's discuss about, first of all, combined OCPs. What are combined OCPs? We have estrogen. Very good. We have estrogen plus progesterone. We have estrogen plus progesterone. Okay, like Mala N and Mala D. Okay, we have estrogen as ethinyl estradiol. Ethinyl estradiol plus, and we have a progesterone, levonorgestrel. We have a progesterone, levonorgestrel. Okay, how much ethinyl estradiol is there, my dear students? It is very less, 30 micrograms. And how much of levonorgestrel? 150 micrograms. Okay, and you have around 28 pills, 21 pills of OCP. Tamoxifen adverse effect on endometrium. DRAS, it will cause an endometrial hyperplasia. Tamoxifen is a selective estrogen receptor modulator that will cause an endometrial hyperplasia, and that can predispose to the endometrial cancer. Okay, so remember that it's micrograms. Okay, I'm discussing micrograms. Okay, chalo. Now OCPs increase which cancer? Is it clear? OCP, that's why rather using tamoxifen we can use raloxifene. Okay, because raloxifene has no action, no adverse effect on the endometrium, and this raloxifene is the same drug, selective estrogen receptor modulator, used in case of osteoporosis as well. So let's write it down, guys. OCPs increase which cancer? Hepatic cancer. In hepatic cancer, which exactly, guys? Hepatic adenoma. Okay, more chances of hepatic adenoma or hepatic hemangioma. Okay, followed by that, guys, they also cause cervical cancer, but cervical cancer mainly is 16 and 18, HPV 16 and 18. More precisely, if you have to answer HPV 16. And also they increase the chances of breast cancer. They increase the chances of breast cancer. They decrease, if I talk about endometrial cancer, they decrease, sorry, OCPs, they decrease the chances of endometrial cancer. Okay, they decrease the chances of ovarian cancer and uterine cancer. Okay, but if I talk about endometrial cancer, endometrial cancer is increased. Because of a drug, because of a drug called tamoxifen. It belongs to a class selective estrogen receptor modulator. What will do this tamoxifen do? It will cause endometrial hyperplasia. It is causing endometrial hyperplasia. This is again a PYQ asked multiple times. Okay, and that's why rather using tamoxifen, we can use a safe drug. I'm writing here, we can use a safe drug, same class, called as a raloxifene. Raloxifene is also a SERM and is a drug of choice in a patient less than 50 age. For osteoporosis, your drug of choice will be estrogen. But raloxifene, you just remember raloxifene is used in osteoporosis as well. But drug of choice for osteoporosis is what? Bisphosphonates, having a side effect of esophagitis. And the rank ligand that we use in osteoporosis, what is the drug? Called as denosumab. Drug of choice will be, investigation of choice will be bone DEXA scan. So remember these things about osteoporosis. Okay, chalo, guys. Now what are the contraindications of OCPs, guys? First of all, absolute contraindication if the patient is having any cardiovascular disease, if the patient is having any liver disease, because they can cause hepatic adenoma, if the patient is having any abnormal uterine bleeding, you cannot use. If the patient is having pregnancy, again they are contraindicated. Or a patient having thromboembolism. So what will be a relative contraindication, mice? Relative contraindication will be age less than 40. Okay, if a patient is having any renal disease, patient having diabetes, patient hypertensive and migraine. migraine and migraine as well. One more relative contraindication you will remember, guys. One more relative contraindication, gallstones. Gallstones. So this was all about OCPs. This was all about OCPs. And again, a little bit more about contraception, guys. Up to 72 hours. Up to 72 hours, you can use a drug, levonorgestrel. Unwanted 72, levonorgestrel. Levonorgestrel is exactly a class of it's a generation. It's a which generation of progesterone is levonorgestrel, guys? Answer in the comment section. Which generation of progesterone levonorgestrel belongs to? Okay, and you have to use it 1.5 mg, one pill. If two pills, then 0.75 each. Okay, but usually we have 1.5 mg. The drug that can be used up to 120 hours, the drug that can be used up to 120 hours is your drug ulipristal, and that belongs to a class of a drug called as SPRM, selective progesterone receptor modulator. Selective progesterone receptor modulator. Selective progesterone receptor modulator. Is that clear to everyone? Is that clear to everyone? Yes, write down in the comment section. Yes, everyone please write it down. Is this clear? Arina, third generation. No, levonorgestrel belongs to second generation. Levonorgestrel and norgestrel, second generation. Remember that. Third generation, we have desogestrel, etonogestrel, norgestinone, norgestimate, that all. Okay, that belongs to third. And nestoron to fourth generation. First, we have cyproterone. We have tibolone. Tibolone. Now, first generation tibolone is a drug of choice. Tibolone usually we use in a patient having a post-menopausal hot flush. That time, the best drug is tibolone. Tibolone, first generation. Okay, is this clear to everyone, guys? OCPs? OCPs are clear to everyone? Yes. And for contraceptive failure, for contraception failure, we have a classical index. Contraception failure, we have a classical index called as Pearl index. We have a classical index called as Pearl index. Let's move to the next quiz, next point. So that was all the PYQs related to that. OCPs, remember, I will also discuss about intrauterine contraceptive devices in the next question, guys. Okay, IUCDs are very important as well. So what is the number of deliveries performed by type A PHC? So we have two types of PHC, type A PHC and type B PHC. So what will be your answer for type A PHCs? What will be the number of deliveries that will be performed in a type A PHC? Type A PHC, what will be your answer, guys? Write down the answer. Yes, so let me discuss, guys, type A and type B. If I talk about type A, yes, excellent, we have less than 20. Okay, so type A, if I talk about deliveries, we have less than 20 per month. We have less than 20 per month. If I talk about type B, we have more than 20 per month. We have more than 20 per month. If I talk about staffing pattern, guys, there will be a MBBS medical officer. MO means medical officer. There will be one. Okay, there will be Ayush medical officer. There will be Ayush medical officer 1. Okay, and total staff will be around 13 to 18. 13 to 18. Here there will be in type B, guys, more than 20 per month, and staff, if I talk about MBBS medical officers, will be 2. Ayush will be 1. Ayush medical officer will be 1. Okay, and total staff will be around Total staff will be around 14 to 21. Total staff will be around 14 to 21. So you got it correct, guys. The answer is less than 20. The answer will be less than 20. So remember, guys, more than 20, it's type B PHC. A 30-year-old patient presented with hypopigmented patch, loss of cold sensation followed by hot touch and pain along with a palpable ulnar nerve. What is your most likely diagnosis? Very easy one, guys. Your most likely diagnosis is yes, ulnar nerve is involved. There are hypopigmented anesthetic patches will be written. Okay, patient has a loss of sensation, guys, cold followed by hot. Okay, your answer is going to be right. Your answer is going to be, what will be your answer? Excellent. Your answer is going to be, sir, leprosy. Your answer is going to be leprosy. Okay, I know the exact questions, exact language of the question is not same that has been asked in the exams, because I myself experienced the exams and the recalls later on. The wording is, language is exactly different over there. Lot of nervousness, anxiety, stress, okay, time management, it's all different stories over there. And the only person who knows what exactly is happening, no teacher in whole country knows what exactly is happening there at that particular moment. Only the one who is writing an exam only knows that what exactly is going on there. Okay, no one knows. During my time I also felt the same, guys. After that, stories are different. Okay, people will tell the question was like this, the easy one and all, but trust me, guys, there's no exact, you need to learn. We need to add one more subject, that's English, because you never understand NB English what they are exactly asking, because the wording of the questions keeps in such a way that you guys are confused at that time. Okay, but yes, if the questions are not same but topics are same, topics are exactly same, है ना? So they will not give such a piece of a cake, hypopigmented patch, unknown love, cold sensation. इतने सारे हिंट तो नहीं देते. इतने सारे हिंट देते तो रिजल्ट 60-70% आ जाता. If so many hints will be in the question, then the result would have been easily going to the 50%, because every one of you is working immensely hard for the last 3, 5, 4 months. Somebody is working from last 1 year, some 1.5 year. So it's not that you guys are not working hard. It's just the presence of mind over there, controlling the pressure and all. Okay, इतना भी easy नहीं आता, ठीक है? But yes, there can be a number of lesions given. Depending upon that, you can understand whether it is a multibacillary leprosy or the paucibacillary. Then the treatment regimes, drugs are same, but the duration of treatment differs. So that particular way you can understand that question. Okay, इतना तो देंगे नहीं. पेशेंट को कफ है, कराइजा है, कंजक्टिवाइट्स है, तो कफ कराइजा कंजक्टिवाइट्स also called as rubiola, you diagnose it with the measles. No, they don't give such a piece of a cake. Okay, yes, there will be 10 to 15 questions like that, but not from such topics. But yes, always be positive. You trust your efforts, you are studying hard, you trust your knowledge, and you guys will get it. Eventually you guys will get it, है ना? Sometimes it is delayed by the luck, it is delayed by the God, but be thankful for every single thing. You give your best so that tomorrow you will not die of a guilt, है ना? Guilt नहीं रहना चाहिए कि you haven't worked hard. You give your best, then leave the rest up to God. Okay, so let's discuss about types of leprosy, paucibacillary and multibacillary. If I talk about number of skin lesions in a paucibacillary, guys, we have 1 to 5. Number of lesions, we have 1 to 5. If I talk about multibacillary, guys, we have more than 5 lesions. We have more than 5 lesions. Okay, if I talk about the treatment, okay, if I talk about a treatment, we have 3 drugs, guys. What are the 3 drugs for paucibacillary? We have rifampicin, okay, we have dapsone, and we have clofazimine. We have rifampicin, we have dapsone, and we have clofazimine. And what are the drugs for multibacillary, guys? Same drugs. We have same. Okay, if I talk about duration of the treatment, that can be asked, guys. Duration of the treatment in paucibacillary, we have 6 months. And for multibacillary, we have 12 months. And for multibacillary, we have 12 months. If I talk about follow-up, my dear students, we have follow-up yearly for 2 years. We have a follow-up yearly for 2 years in possibacillary, and follow-up for 5 years yearly for 5 years in case of a multibacillary. So that's about a type of leprosy. If a question comes, most common nerve, so which nerve is involved, nerve damage, what will be your answer, my dear students? Your answer goes to ulnar nerve. Okay. If the question is mentioning that which of is the most common cranial nerve involved, if I ask cranial nerve involved, then your answer goes to a facial nerve. Okay. One more question that has been repeatedly asked, guys, type of lepra reaction. So let me tell you about lepra reaction. यहाँ पे लिख देता हूँ. Tell about lepra reaction. So in lepra reaction, remember guys, rule of 5. Remember the rule of 5. Okay. So type 1 lepra reaction have which type of hypersensitivity, guys? What you will add to 1, it will become 5. You will add 4. So you have type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction. Okay. If I talk about type 2 lepra reaction, this was the question asked in January 2023 exams, that type 2 lepra reaction will have which type of hypersensitivity. So your answer goes to type 3 hypersensitivity reaction. Type 3 hypersensitivity reaction. Type 3 hypersensitivity reaction. Okay, so remember guys, leprosy, everything about that, possibacillary, multibacillary, nerve damage, cranial nerve damage, and very important, lepra reactions, rule of 5. If type 1, it goes with the type 4 hypersensitivity. If type 2, it goes with the type 3 hypersensitivity reaction. Next question, guys. Which government program aims to provide health checkups and services for children aged 0 to 18, including a focus on those not attending the school? So what will be your answer for this question, guys? Which program aims to provide health checkups and services for the children aged 0 to 18, including a focus on those not attending a school? Including a focus on those who are not attending the school. Your answer is? Very good. It's Rashtriya Bal Swasthya Karyakaram. Excellent. Okay. So what exactly is this program, guys? It involves the screening of a children from birth to the 18 years at the age of 4Ds: defects at birth, disease, deficiencies, and development delays, spanning 32 common health conditions for every detection, and free treatment and management, including the surgeries at tertiary level at a super specialty hospitals. Okay. If I talk about JSY, Zanani Suraksha Yojana, Asha is a part of this scheme. It's a government program that focuses on the promoting institutional deliveries by providing the financial assistance to the pregnant woman. As per this scheme, they are getting a lot of benefits. Then NSSK, it's Naujat Shishu Suraksha Karyakaram. It's a program that aims to provide care of newborns and ensure their survival during the first 28 days. So first 28 days, you remember NSSK, 0 to 18 years. You remember the Rashtriya Bal Swasthya Karyakaram. For a pregnant ladies, you remember JSY. And the midday meal program, guys, it's a school-based initiative that provides a nutritious meals to the school children to enhance their nutritional status and encourage their school attendance. So this was all about these programs. Now can you tell me, as per a midday meal program, how much of calories and proteins are given? Comment down faster, guys. As per the midday meal program, write down in the comment section. Write down in the comment section, guys. Midday meal program, how much calories and protein they will give? Yes. how much calories and protein they will give. It's again a question, guys. I've discussed in the main classes as well. Anyone? Faster? Not hurry, not in grams, I'm asking. Yes? How much calories and protein? Comment it down. Yes, it's 1 by 2 protein and 1 by 3 calories. Calories. 1 by 2 protein and 1 by 3 calories. Chalo. Let's move to the next question. What is a serial interval? What is a serial interval? It's a time to develop a primary case. It is a time gap between an entry of an organism till the maximum infectivity. It's an interval between the primary and secondary case, or it's a time gap between onset till the first detection. So what is the answer for this question, guys? What is a serial interval? Again, an easy question, guys. I discussed in our main notes of class. It's a time interval between primary and secondary case. It's a time interval between a primary and secondary case. Okay. Now, if I talk about time gap between the onset till the first detection, that is a latent period. That is a latent period. If I talk about a entry of an organism till the maximum infectivity, if I talk about entry of an organism till the maximum infectivity, that is a generation time. Draz, that is a generation time. That is a generation time. And time between primary and secondary case, it is a serial interval. It is a serial interval. Now let's discuss some definitions, guys. What is primary case? What is primary case? It is a first case of a disease. It's a first case of a disease. It's the first case of a disease. What is secondary case? Case developed from a primary case. It's the case developed from primary case. It's a case developed from primary case. What is the index case, my dear students? It's a first reported case. It's the first reported case. It's the first reported case. It's a first reported case. What do I mean by incubation period? These all definitions are important, my dear students. Incubation period. It's a time interval between entry of an organism till the first sign or symptom. Time interval between entry of organism till first sign and symptom. Till first sign and symptom. Till first sign and symptom. Okay. After that, my dear students, remember the entry of an organism till the first antibody detectable. Till the first antibody detectable, that is called as window period. That is called as window period. Remember that as well. What is generation time? The entry of an organism till the maximum infectivity will be the generation time. So remember all these definitions: primary, secondary, index, incubation, generation time, and serial interval. Okay. Next question. What treatment should be administered to a patient diagnosed with the Plasmodium falciparum malaria from a northeastern state? Northeastern state, Plasmodium falciparum. So what will be your answer for this question, guys? Comment down the answer. What will be the answer? What will be the answer? What drug you will administer in a patient who is diagnosed with the malaria caused by the Plasmodium falciparum and he's from a northeastern state? So your answer is going to be very good. All those people who are answering, yes, artemether plus lumefantrine. Artemether plus lumefantrine. Okay, so let's discuss the treatment of a malaria, my dear students. It's very important. Malaria is also very important, guys. If it is Plasmodium vivax, yes, I will, Aryan, thank you. I am glad my sessions are helping. I will share the PDF. You guys just ping me on the Telegram or just search in my Telegram channel, FMG with Dr. Talib Bilal, and I will share the PDF. Okay, you guys don't write, you guys just read and understand the session. Okay, you guys just answer and listen to the session. Okay, and rest I will forward the PDF. Okay, I'll forward you the PDF. What I will do to PDF, this is for you guys, so it will go to you guys. Chalo. Plasmodium vivax, if they ask, if Plasmodium vivax, your answer is chloroquine in all states. The treatment, my dear students, will only change. The treatment will only change when it is Plasmodium falciparum. When it's Plasmodium falciparum. If Plasmodium falciparum, my dear students, in northeastern states, your answer is going to be ACTL. ACTL, that is artemether and lumefantrine. Artemether and lumefantrine. Artemether and lumefantrine, along with that primaquine. Okay, and if I talk about other states, then your treatment is going to be ACTSP. Your treatment is going to be ACTSP, that is artesunate and sulfadoxine. That's artesunate and sulfadoxines. Remember that. Okay, now also what is more important from malaria, guys, in pregnancy, what will be the treatment? So I'll write in pregnancy, my dear students. Remember, malaria with pregnancy. So if in pregnancy, write down the answer. If in pregnancy it is due to the Plasmodium vivax, if in pregnancy, if it's Plasmodium vivax, then your answer again is going to be the same, chloroquine. Your answer again is chloroquine. If it is Plasmodium falciparum, it also causes anemia, guys. You have classical blood picture given. Okay, yes, first trimester, your answer is quinine. Very good. First trimester, your answer is quinine. Second trimester, yes, second and third chloroquine is same. Okay, second trimester, like second trimester onwards, when the organogenesis has been completed, if northern eastern states, your answer is going to be ACTL, and other your answer is going to be ACTSP. Now that you already know that what exactly is ACTL, artemether and lumefantrine, and there is artesunate and sulfadoxine. Remember, my dear students, primaquine is contraindicated in pregnancy. Primaquine is contraindicated in pregnancy. Then for the prophylaxis, you also give what in prophylaxis? You also give mefloquine as a drug. So remember, malaria with pregnancy, if it is, again I will repeat, if it is Plasmodium vivax, your drug of choice is to be chloroquine. If it's due to the Plasmodium falciparum, first trimester, your drug of choice is quinine. Second, if northeastern, ACTL, and then ACTSP. Normally Plasmodium vivax, chloroquine is a drug of choice in all states. If falciparum, ACTL. If other states, ACTSP, artesunate and sulfadoxine. Remember that. Malaria, my dear students, which protein? Histidine rich protein test. Chalo. What is the name of the pregnancy test kit introduced by the Indian government? What is the name for the pregnancy test kit named by the Indian government? Write down the answer, my dear students. Yes, your answer is going to be Nischay. Your answer is going to be Nischay. Okay. If I talk about a Nikshay, what is Nikshay? It is a technology-based surveillance for TB. It's technology-based surveillance for TB. If I talk about Nikust, it is related to the leprosy. Okay, it's technology-based surveillance for leprosy. Okay, and if I talk about Akshaya, guys, it's an initiative funded by the Global Fund for Malaria and TB. Okay, Nischay for a pregnancy kits. Nischay for the pregnancy kits. Nikshay TB. Nikust for leprosy. Nikust for the leprosy. Very good. Next question. What is an absolute contraindication for the device depicted in the image below? Okay, so what is the device? It's an intrauterine contraceptive device. What is the exactly device? It's a second generation contraception device, IUCD, called as copper T380A. It's a copper containing contraception device having a lifespan of, this was the question asked, what is the lifespan of this IUCD? It is 10 years. It is 10 years. Now you have to say that what is an absolute contraindication. What is an absolute contraindication for the device? Okay, now if I talk about IUCDs, we have 4 generations. How many generations? We have 4 generations. In the first generation, my dear students, you have a Lippel's loop. In the first generation, you have a Lippel's loop. If I talk about second generation, you have copper containing IUCDs. You have copper containing IUCDs. If I talk about third generation, you have hormonal containing like Mirena. You have hormonal containing like Mirena. And if I talk about fourth generation, what is the hormone that is inside? Levonorgestrel. And if I fourth generation, you have Flexigard. You have Flexigard. So remember, first generation, second generation, third generation, and fourth generation intrauterine contraceptive device. So copper containing one are the second generation, that is in the picture, classical picture of copper T380A. One question was asked this month. Second question was asked, what is the lifespan? It will be 10 years. Now the other question that they can ask is about the contraindications of these intrauterine contraceptive devices. Okay, so let's discuss the contraindication. If I talk about, let me differentiate them with a line. Okay, I will write it here. What are the absolute contraindications and what are a relative contraindication? So one side will write absolute, second side will write relative contraindication. So what are the absolute contraindications? First of all, remember, absolute contraindication number 1 will be pregnancy. So you cannot use a intrauterine contraceptive device during the pregnancy. Why? Because patient can have what? Complications due to the hormones. Number one thing. Number second thing, patient is already pregnant. What is the use of an intrauterine contraceptive device? She has been already pregnant. Okay. Number third thing will be, if there is a failure of a contraception or if there is a pregnancy in situ. What I mean by pregnancy is pregnancy when IUCD in situ. If the patient is pregnant by having IUCD inside, the question they will ask, what is the management you have to do? First of all, remove the IUCD, remove the thread. If you're not able to locate, you go for the abdominal x-ray, you go for the hysteroscopy, and sometimes you go for a USG as well to locate the contraceptive device. The question that I will directly land on the hint, if you have to remove, if it is inside the uterus. Inside the uterus is mentioned in the question, then how you will remove? You will go with the hysteroscopy. You will remove with hysteroscopy. If the question mentions it's outside the uterus, how you will remove, my dear students? Laparoscopy. This will be the hint in the question. If a device is inside the uterus, you will go with the hysteroscopy. If outside the uterus, you will go with the laparoscopy. And if after removing the intrauterine contraceptive device, if the patient is saying that she still wants to keep the baby, advise her Tell her about the risk factors, that there can be chances of abortion more than 50%. And then if she doesn't want to continue the pregnancy, then you have to go for medical termination of the pregnancy, okay, by giving the two drugs, mifepristone and misoprostol. One will kill the fetus and another will expel the fetus out. Remember the dosage of that as well. I've discussed in the high OB-GYN videos as well. Chalo. Okay, this is the main hint. Okay, now pregnancy is the absolute contraindication. First, second one, patient can have recurrent, if the patient is having a recurrent PID. If the patient is having a recurrent PID or a current PID, recurrent or current PID is an absolute contraindication. If a patient is having abnormal uterine bleeding, okay, any bleeding other than the normal menses, abnormal uterine bleeding. If the patient is having cancer cervix, if the patient is having cancer cervix, or if the patient is having previous ectopic pregnancy, because ectopic pregnancy can also be because of an intrauterine contraceptive device, but most common cause of an ectopic pregnancy goes to PID, which is also called as salpingitis ischemic nodosa. Chalo, previous ectopic pregnancy, previous ectopic pregnancy. Okay, if I talk about relative contraindications, write it down, guys. If the patient is having anemia, that will be a relative contraindication. First one, if the patient is having a history of PID, if the patient is having a history of PID, if the patient is having any purulent cervical discharge, if the patient is having uterine malformation, for example, we have unicornuate uterus, bicornuate uterus, or septate uterus, or if the patient is having fibroids, or if there is an unmotivated person, of the person doesn't want it, relative contraindications. Why? Because why anemia is a relative contraindication? Because the side effect of this IUCDs are what? Menorrhagia. What is menorrhagia? When the bleeding exceeds more than 80 ml. Now, if the patient is already anemic, if the patient is already having less hemoglobin, and you are giving IUCD, what is the most common side effect? Menorrhagia, pain, perforation, ectopic pregnancy. Okay, these are all the side effects of IUCD. So which of the following will be the answer now? Which is the absolute contraindication? Which of the following is an absolute contraindication, guys? Anemia, uterine malformation, uterine fibroid, or vaginal bleeding? Your answer goes with vaginal bleeding. It is an absolute contraindication, and other are what? A relative contraindication. So what is the answer, guys? What is the answer? The answer is a vaginal bleeding. Okay, the answer goes with a vaginal bleeding. The answer goes with a vaginal bleeding. Okay, if I show you in the question, guys, see, this is the first generation Lippels loop. This is the third generation Mirena. This is the second generation copper containing, and this one is the Lippels loop. Okay, remember these generations of IUCDs. Chalo, remember these all. Let me show the picture from the contraception. All these are the generations, first, second, third, and fourth, having Lippels loop in the first, Grafenberg ring in the first, Flexigard in the fourth, copper containing is second, and hormonal containing is third generation. Followed by that, this is a classical picture of a Mirena, guys, third generation ICD, having a lifespan of 5 to 7 years. This one goes to the copper T380A, having a lifespan of 10 years, and this one goes to the Lippels loop, having a first generation, but it's very old, we don't use it now. Okay, followed by that, mechanism of action, I've already discussed, and relative and absolute contraindications as well. Chalo. And then the side effects, guys, they can cause menstrual irregularity, having menorrhagia. They can cause pain and infection. That can be the cause of a removed IUCD. Failure, if there is a failure, if it's inside the uterus, hysteroscopy. If outside the uterus, laparoscopy. Due to the infection, they can cause ectopic pregnancy. Due to the displacement, they can cause perforation. And due to the heavy bleeding, they can cause anemia. These are all the side effects of IUCDs. Then followed by that, we have already discussed the combined OCPs, ethinyl estradiol and levonorgestrel, guys, 30 micrograms of estrogen and 150 micrograms of progesterone. We have 21 pills and 7 pills of iron tablets. I've already told you SPRM as well, which is given up to 120 hours. OCP with the cancers, we have already discussed this as well, because contraception questions are very, very important. So remember, breast, cervical and hepatic will increase, endometrial, ovarian and uterine, it will decrease. Okay, it will decrease. Chalo guys. Which of the following is, now it's clear guys? Now clear? IUCDs are clear? Everyone in the comment section. Which of the following is responsible? Which of the following is responsible for the maintaining the birth and deaths in India? Which system is responsible for maintaining the birth and deaths in India? That goes with the vital registration system. That goes with the vital registration system. Okay, now if I talk about this system, my dear students, the birth registered, write it down. The birth registered, okay, within 21 days. Within 21 days. Birth registered within 21 days. Okay, if I talk about death registered, also within 21 days. Also within 21 days. And if it is NRI, okay, then within 60 days of arrival. Within 60 days of arrival. 21 days, 21 days and 60 days of arrival. Very good. So your answer is going to be vital registration system. Vital registration system. Next question. As per the guidelines for disposing of biomedical waste, what color bag should be used to discard the cotton swabs? So for the cotton swabs, what is the color you will use? For the cotton swab, what is the color that we will use? Yes, yellow color. Okay, yellow color. So for all the human anatomical waste, all these things, infectious waste, non-recyclable waste, they will go into the which color, my dear students? They will go into the yellow color. So write it, understand this picture guys. All the human tissues, organs, body parts, fetus or animal carcasses, body parts, tissues will go into the yellow color. Contaminated items with the blood and body fluid will go to the yellow color. Okay, antibiotics, cytotoxic drugs, chemicals will go into the yellow color, and all the discarded mattresses, bedding and all these go into the yellow color. If I talk about red color guys, tubings, rubber tubings, IV tubes, sets, catheters, syringes and gloves will go into the red color. All the sharp materials, scalpel, needle, blades will go into the white color, and broken or discarded contaminated glasses or body implants like pacemaker, okay, like rod in the leg, they will go into the blue color. Incineration for the yellow color guys, what will be the temperature of the incineration? Incineration is a process done, okay, 1200 Celsius. And then these things guys, we recycle and reuse. These three we recycle and reuse. We go for the autoclave with a temperature of 121, okay, autoclave, and then we use them further. Okay, for white reuse, we reuse after the shredding. For white we reuse after the shredding. Okay, chalo. Which type of resistance is exhibited by the patient who is unresponsive to the isoniazid, rifampicin, ofloxacin and kanamycin? If we talk about anti-TB drugs, guys, now if a patient is resistant to isoniazid, and if the patient is resistant to the isoniazid and rifampicin, your answer is going to be multi-drug resistance. If the patient is resistant to 4 drugs, that is one injectable drug, kanamycin or any aminoglycoside, ofloxacin, isoniazid and rifampicin, your answer is going to be extensively drug resistance. There is nothing like what about the black color? All the coverings like plastic items will go into the black. Okay, now if the patient is using a catheter, cover of a catheter will go into the black bin. Okay, cover of a catheter will go into the black bin. Okay, plastic items, polythenes, wrappers, covers, they will all go into the black bin. Okay, they will go into the black bin. Now, yes, patient who is unresponsive to the isoniazid rifampicin, that goes with the extensive drug resistance. Your answer is going to be extensive drug resistance. If a patient is resistant to isoniazid and rifampicin, then your answer is multi-drug resistance. That answer is multi-drug resistance. What is mono-drug resistance? Mono-drug resistance, if a patient is resistant to any first-line drug. Resistance to any first-line anti-TB drug. Anti-TB drug. First line we have HRZE. We have HRZE. Okay, chalo. Now, anti-TB drugs and their side effects. Okay, now let me discuss. We have isoniazid. What is the side effect of isoniazid, my dear students? It is peripheral neuropathy. It causes peripheral neuropathy. If I talk about second one, rifampicin has a side effect of orange color secretions. Rifampicin has a side effect of orange color secretions. Okay, if I talk about third drug, pyrazinamide, anti-TB drugs are very important. If I talk about pyrazinamide, what is the side effect of pyrazinamide, guys? It causes hyperuricemia, gout, increased uric acid. And when there is increased uric acid, gout. Acute gout, NSAIDs, chronic allopurinol. Chalo. If a patient is taking ethambutol, patient has a side effect of optic neuritis. And if a patient is taking streptomycin, then you already know aminoglycosides has a side effect of ototoxicity. That has a side effect of ototoxicity. Most common or most ototoxic aminoglycoside if asked, that will be kanamycin. Sabse zyada kanamycin. Now about this anti-TB drugs, these are the first line, HRZE. All these drugs are bacteriostatic except one. It is bactericidal. Okay, all other are bacteriostatic. BS. Okay, this is again the question. All of these drugs are bacteriostatic except isoniazid. What is bacteriostatic? That will stop the growth of the bacteria. What is bactericidal? That will kill the bacteria. Now we have a new regime of anti-TB drugs called as B-PAL regime. Remember this, very important, and this was the question asked. Okay, what is B-PAL regime? It's a new regime, B-PAL regime. There are three drugs, my dear students. B for bedaquiline, P for pretomanid, and L for linezolid, and N for linezolid. And last FMG question was asked, what will be the mechanism of action for the drug bedaquiline? What will be the mechanism of action, my dear student? Mechanism of action of bedaquiline will be ATP inhibition. It will be ATP synthase inhibition. Okay, ATP synthase inhibition. The side effect will be, it is an hepatotoxic and it caused prolonged QT interval. Side effect kya hai? Prolonged QT interval. Okay, so that is all about a TB. Remember, side effect is QT prolongation. And also it's a cardiotoxic drug, bedaquiline. Is clear? And we have a TB surveillance called as Nikshay, and Nikshay is for the STD. Okay, and under the Nikshay Poshan Yojana, how much money is to be given to the TB patient? 500 rupees. So they are being given 500 rupees per month. Okay, under the which Yojana, guys? Nikshay, under the Nikshay Poshan Yojana. Under the Nikshay Poshan Yojana. Remember this as well. So it's all about tuberculosis, and TB is the most common opportunistic infection. I'm again repeating, tuberculosis is the most common opportunistic infection associated with the patients having HIV. So the question is, if what is the most common opportunistic infection in a patient having HIV in India? It's TB, but in a world it's pneumocystic jirovecii pneumonia, PJ pneumonia. Is it clear? Anything else about TB, my dear students? So remember, peripheral neuropathy, okay, orange color secretions, increased uric acid, optic neurites, and ototoxicity. Okay, streptomycin belongs to which class of drug? Aminoglycosides. And aminoglycosides, mechanism of action again from the pharmacology, they inhibit 30S ribosomes. Okay, 30S ribosome protein. Okay, at 30 को याद रखना, AT at aminoglycosides and tetracyclines 30S, rest all 50S. बाकी जितने भी है 50S. Aminoglycosides and tetracycline goes to the 30S ribosome. 30S ribosome. Okay. Next question, guys. So remember, multi-drug is isoniazid and rifampicin. Mono drug resistance is any one drug from first line HRZD. Extensive is one injectable, ofloxacin, isoniazid and rifampicin. And extremely, there is nothing like extremely. Okay. Chalo. A couple visited the doctor expressing the concern about their son's preference for consuming food from a multinational companies. How can we describe the transition from consuming traditional natural food to indulging in Western fast foods? So, by mixing the culture from Westernism to the Indian culture, okay, what will be this called as? It will be called as acculturation. Okay, adapting the other culture, it is called as acculturation. चलो ठीक है, acculturation. At what age will be the dose of hepatitis vaccine given? So as per the universal immunization program, according to that, hepatitis vaccine first dose will be given at birth, 6 weeks, 10 weeks, or 6 months. Write down in the comment section what will be your answer. At what age first dose of hepatitis vaccine is given? At what age is the first dose of hepatitis vaccine given? Very good. It is at birth. Your answer will be at birth. So let's discuss very important now all the tables. Now questions are finished, guys. I have mentioned few tables and these all the tables are very important, है ना? Question तो आएगा ही. चलो. Now at birth, what are the vaccines we will give at birth? Remember, with a mnemonic called as Bob. Okay, so at birth we will give BCG, at birth we'll give OPV, and at birth we'll give hepatitis B. At birth we'll give Bob. We'll give BCG, OPV, and hepatitis B. If I talk about at 6 weeks, we'll give DPT1, we'll give OPV1, we'll give Hep B1, and we'll give HIB1, and we'll give Rota vaccine 1. Then followed by that, guys, 10 weeks and yes, I will. That program is called Ninu. So could you please share this? That program is called as NTEP. Okay, NTEP, National Tuberculosis Elimination Program, and it was said before by 2025 we will eliminate, not eradicate, eliminate. Okay, eliminate, eradicate pura jad ke. We have elimination program. Okay, but now due to the COVID-19 and all things, it's supposed to be eliminated by 2030. Okay, that is the program NTEP. I'll show that picture as well. Chalo. At 10 weeks, it's DPT2, it's OPV2, it's Hep B2, it's Hib2, and it's Rota vaccine 2. At 14 weeks, same third one, it's DPT3, it's OPV3, Hep B3, Hib3, and Rota vaccine 3. At 9 months, we usually give measles MR, we give Japanese encephalitis 1, and we also give vitamin A. Remember that as well. We also give vitamin A. 16 to 24 months, we give usually OPV booster dose and DPT booster dose, and we also give Japanese encephalitis second dose and measles second dose. At 5 years, we give DPT second booster, and 10 to 16 we give DD. Okay, that goes with a universal immunization program. Now my question to you, which of the following vaccine will cause intussusception as a side effect? Intussusception as a side effect, tough to memorize. Just remember at birth Bob, उसके बाद 6, 10, 14, you just have to remember the same line depending on the increase in 1, 2, 3. 10 to 16 is DD, है ना? तो birth का ही पूछेंगे. Which of the following vaccine can cause intussusception as a side effect? So the examiner will mention the question that after the vaccination, patient had a sausage-shaped lump. Okay, sausage-shaped lump with a red color jelly stools. Intussusception, rotavirus. Okay, persistent crying. Another question. Very good, Sheen. Rotavirus. Persistent crying will be a side effect of which vaccine? P for persistent crying, P for pertussis. That goes to the pertussis. That goes with the pertussis. Very good. That goes with the pertussis. Okay. After that, miliary TB. Miliary TB is a side effect of which vaccine? Miliary TB is a side effect of which vaccine? Miliary TB is a side effect of which vaccine? Tell me. Miliary TB is a side effect of which vaccine? BCG. That goes with the BCG. ठीक है? चलो. Choose incorrect statement in a given table of vaccine strains. So let's recall some vaccine strains. BCG is Danish 331, that's right. Yellow fever is 17D, that again is the right answer. Measles, we already discussed, Admonstron Zagreb. And the last one, rubella is Oka. No, Oka is not a rubella. Oka is for varicella zoster. Okay, for rubella, it's RA273. For rubella, it's RA273. So let's discuss the vaccine strains. First vaccine, if I talk about BCG, if I talk about BCG, your answer goes with Danish 1331. If I talk about yellow fever, your answer is going to be 17D. If I talk about Japanese encephalitis live, अगर live की बात करूँ तो your answer is going to be SA 14142. If I talk about Japanese encephalitis killed, then your answer is going to be Nakayama. Then answer goes to Nakayama. If the answer is Rota vaccine, it's R1X4414. If your question is influenza, recall all the strains in the comment section, guys. They are important from a microbiology point of view, and also this. Yes, if it is influenza, your answer goes to A72009 California. Chalo, influenza. Drug of choice influenza, oseltamivir, neuroaminidase inhibitor. If I talk about measles, your answer is going to be Admonstron Zagreb. If I talk about mumps, then your answer is going to be Geralin. Okay, most common complication of the mumps will be Yes, in adolescents it is orchites and oophorites. In children's it is aseptic meningitis. Overall most common complication is aseptic meningitis. Chalo, ठीक है. After, that's why in a mumps patient we always start a prophylactic treatment for a meningitis. ठीक है. Mumps, measles, you already know most common complication goes to otitis media, but the rarest complication goes to the subacute sclerosing panencephalitis. If I talk about rubella, अगर रुबेला की बात की जाए, what is the vaccine that you will give? RA27-3, that is RA27-3. If I talk about chickenpox, then it's Oka strain, varicella zoster, साथ में ये भी लिख दो, varicella zoster, that is Oka strain. If I talk about IPV की बात की जाए तो it's Salk, and OPV Sabin. So this is all about a vaccine strain. So revise with me, guys. If I talk about BCG, Danish 1331, yellow fever goes to 17D, Japanese encephalitis live goes to SA14142, Japanese encephalitis killed goes to Nakayama, Rota vaccine R1X4414, influenza A72009 Caliph, measles Admonster Zagreb, mumps Gerelin, rubella RA27-3, chickenpox Oka, IPV Salk, OPV Sabin. So these are all the strains. Now let's discuss the all disease. It's a miscellaneous slide. All the disease and their agents. Okay, last one, guys. All the disease and their agents. I must think you guys are tired, but it's just 2 hours and few minutes. Okay, 2 hours 10 minutes. Okay, now recall all the agents and the vectors, because whenever the question will mention the vector or an agent, you can directly go to the disease of that particular way. Okay, chalo. If I talk about brucellosis, what is the agent for brucellosis? Write down faster. B. melitensis. What is the agent, my dear students? It is B. melitens. And brucellosis, what is the name of the what is the vector, my dear students? It's due to the unpasteurized milk. It's due to the unpasteurized goat milk. Okay, that's why we are doing phosphatase test, we are doing coliform count during the pasteurization. We are giving methylene blue test, so that will tell us about the contamination. Then that's why we are going for the pasteurization, which is a disinfection process of the milk. Okay, and what is the agent, guys? B. melitensis. What are the two tests for brucellosis? We have rose bengal test. I'm writing it here. You have a rose bengal test, you have a rose bengal test, and you have milk ring test. You have milk ring test. These are for the brucellosis. If I talk about KFD, guys, the agent is group B arbovirus. The agent is group B arbovirus. The vector is hard tick. What is the vector? The vector is hard tick. If I talk about yellow fever, again yellow fever, the agent is group B arbovirus. The agent is group B arbovirus, and a vector is Aedes mosquito. It is Aedes mosquito. If I talk about leptospirosis, it's L. interrogans. L. interrogans. And if I talk about a vector, it will be rat urine. It is due to the rat urine. Okay, rat urine. Can anyone of you tell me what will be the drug of choice for leptospirosis? What will be the drug of choice for leptospirosis? For leptospirosis, what will be your drug of choice? For leptospirosis, what will be your drug of choice? For leptospirosis, what will be your drug of choice? For leptospirosis, what will be your drug of choice? Anyone? Leptospirosis, drug of choice. No, not erythromycin. It is same like mycin. What will be a drug of choice for leptospirosis? Yes, write down. It's due to the rat urine, and the drug of choice Yes, anyone in the comment section? Leptospirosis. Yes, you use tetracyclines as well. Yes, tetracyclines is right as well. Doxycycline है ना, doxycycline. Chalo. Okay, then echinococcus, the agent is echinococcus granulosus. Echinococcus granulosus, and the vector is dog. This echinococcus granulosus causes hydrated cyst. क्या करता है यार? Hydrated cyst. And hydrated cyst, if you remember hydrated cyst, what is an appearance? We have water lily sign present in hydrated cyst. How do you manage this hydrated cyst? We have a pair therapy. P for percutaneous, A for aspiration, I for initiating the scolytical agent. What is the scolytical agent that we use? That is albendazole, which will shrink the size of the cyst, and R is reassurance. Remember that, guys. Remember that pair therapy is used in a hydrated cyst. Water lily sign, P for percutaneous, A for aspiration, I for initiating scolytical agent like albendazole, and R for reassurance. Echinococcus granulosus. Echinococcus granulosus. Okay. There is one more, echinococcus multicularis, causing the malignant hydatosis. But you hydrated cyst, remember. Tenaces, guys, due to the tinea solium, and tinea saginata. Tinea solium and tinea saginata. Okay, and what is the vector? The vector is pork. Or beef. Okay, depending that they can also cause the neurocysticercosis. For neurocysticercosis we have a starry sky appearance. Okay, and starry sky appearance also in the Burkitt's lymphoma. Yaad rakhna, starry sky appearance Burkitt's lymphoma, translocation 814. Starry sky appearance in the neurocysticercosis. CT में क्या दिखेगा? There will be a multiple centric dots with a larva egg inside. But agar simple dots दिखेंगे, then can be a cerebral toxoplasmosis. That can be what? Cerebral toxoplasmosis. Now, for cerebral toxoplasmosis, what will be your drug of choice? For cerebral toxoplasmosis, your drug of choice is going to be a pyrimethamine, sulfazidine, or leucovorin. For neurocysticercosis, your drug of choice is going to be albendazole and steroids. Okay, remember that. So how do you differentiate? If you want to differentiate these two, let me show you here only. See, guys, if this is the picture, what is this? This is not a neurocysticercosis. These are multiple eccentric dots, and between the dots there is nothing. Between these circles there is nothing. Then it goes to the cerebral toxoplasmosis. In pregnancy, your drug of choice is going to be spiramycin, but in normal conditions, your drug of choice is going to be pyrimethamine, sulfazidine, and leucovorin. Okay, but if you have a larva egg inside, ऐसे आएगा like this. Okay, dots in between, then your answer is going to be a neurocysticercosis. And neurocysticercosis drug of choice is albendazole and steroids. Chalo. Tenaces, praziquantel is a drug of choice. For tenaces, praziquantel is a drug of choice. For plague, what is a vector, guys? For plague, it's Yersinia pestis. And vector is a rat flea. For malaria, my dear students, the agent is Plasmodium. It can be any Plasmodium, Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax. The vector is Anopheles female. Okay. For rabies, it is a Lissa virus. And vector is any rabid animal. For dengue, again, your answer is going to be group B arbovirus. Write it down. Your answer is going to be group B arbovirus. And a vector is going to be Aedes. For epidemic typhus, it's R. provozaki, and vector is louse. Okay, here it's R. typhi, and vector is flea. For scriptribus, it's Sutsugumoshi. Tsugamoshi, and vector is mite. And vector is mite. Okay, followed by that rickettsial fevers, guys. For rickettsial fevers, remember, for Rocky Mountain spotted fever, it's R. rickettsii, and vector is hard tick. If I talk about Indian tick typhoid, it's R. coroni, and vector is hard tick. They will not ask directly what is agent and vector. They will give in a clinical case that R. coroni is an agent, vector hard tick is an agent. Then you have to diagnose. These are the hints. These table will not give exact question, but they will be using these small one-liners as a hint in a question so that you can directly land up in the diagnosis. R. pox is R. acari as an agent, and the vector goes with the mite, and the vector goes with mite. So remember all these diseases and the agent and vectors, and the agent and vectors. Now the last one, guys, the last slide, about an epidemiological studies. So in epidemiological studies, we have different types of studies, whether it's a cohort, whether it's a case control, or cross sectional or ecological study. Okay, now if I talk about the first study, that is a cohort study. Now first of all, we are forming the hypothesis by a time, place, and person. Then we test these hypotheses with these disease. Now if I talk about cohort study, what is the direction of the cohort? It's always a forward study. Okay, that's why it's also called from risk factor to disease. Now if a patient is smoking, if a 10 group of 10 people is smoking, so you want to check how many of them will develop a lung cancer after 10 years. So you will put a study from 2024 to 2034. So you're going to study about them in a forward direction. You are going in a future. So such type of study, when you're going from risk factor to disease, you're going from a cause to effect, you're going in a forward way, or a prospective study. Such type of study is called as cohort study. So the direction of the cohort study is forward direction. Okay, now if you're going from disease to the risk factor, you have a patient coming to you with the complaints of, or with the diagnosis of liver cancer, your first question will be, are you consuming alcohol? Okay, you'll ask about an alcohol, and at that time your answer will be, or the study you're going back. Okay, from disease to the risk factor, you're going back in time, backward direction, which is also called as retrospective study. Your answer is going to be case control. So the direction of the case control study is backward direction, If I talk about cross sectional study, it's a type of a study that is done at a point. And ecological study also, which is done at point. And this cross-sectional study, it will tell me about the prevalence of the disease, and ecological study, it will tell me about a population characteristic. Okay, if I'm between these four studies, the first importance will be given to this, followed by case control, followed by cross-sectional and ecological study. But the best study among all will be meta-analysis. सबसे बेस्ट कौन होगी? meta-analysis. Okay, then the unit of study for a cohort will be individual. The unit of study again here will be individual, and then the last one will be population. So the unit of study in ecological studies population, and cohort, case and cross sectional will be individual. Okay, RCT के लिए unit क्या होगा? Patient or the case. The unit for randomized control trial, your answer is going to be patient or the case. Now the parameters, what are the parameters you are checking in a cohort study? With the help of these parameters, they will give you a hint which type of study is that. Okay, which type of study is that. Okay, if I talk about a cohort study, what are the parameters? You check incidence. Okay, incidence is checked. You check a relative risk. You go for a relative risk. You go for attributable risk and population attributable risk. If I talk about a case control, we check the odds ratio, which will tell us about after the interpretation whether the risk factor is associated with the disease or not. You go backward direction, opposite to the cohort. It's also called as Trohock study. Okay, this will tell me about prevalence of disease. It's also called snapshot study, prevalence of disease. And ecological will tell me about the पॉपुलेशन कैरेक्टरिस्टिक, क्या बताएगा? पॉपुलेशन कैरेक्टरिस्टिक, characteristic. This odds ratio is also called as cross product ratio. So in options they will mention, so don't get confused, cross product ratio. So rather going in a detail about these studies, guys, I have discussed, I think, in a PSM Hild discussion about epidemiological studies, experimental and observational. First we form the hypothesis, then we test this hypothesis. In experimental we go for the clinical trials, we go for the field trials, community trials. Okay, chalo. So remember, guys, and the direction is forward. You're going the forward direction, also called as prospective, also called as effect to cause, okay, or risk factor to disease. Your answer is cohort study, forward direction. Backward, disease to risk factor, okay, outcome to, from outcome to effect, or a retrospective or backward direction, case control, at point, cross sectional, and ecological study. Okay, so this was all about epidemiological studies. Remember, the unit of study is cohort. For cohort, case, and cross sectional, it's individual. Ecological, it's population. For RCT, okay, for RCT it is patient or case. Okay, for RCT it is patient or case. Chalo, guys, so good luck for your exams, and we are done with the PYQ sessions, and I hope this is a revision rather than a PYQ session, and I've tried to discuss all the important topics that have been coming again and again in the exams. Revise the PDF. If you want the PDF, guys, you directly go to the Telegram FMGE with Dr. Talib. I will share the okay, here's a QR for the group. You join the channel, guys. I'll upload the PDF over there, okay, or ping me up in the Telegram. Just ask the PDF of PYQ and PYTs. I will share. Okay, you can also solve the questions every day. Till then, keep studying, keep revising the things, and if you have any doubts coming up, you guys can ask the doubts in the Telegram, but message should be only related to the doubts, okay, nothing else. Sir, I know this might be a very silly, but please PSM message 20 marks dilwa de. You study, you will get it, okay. Study the good source, study these notes, watch the high discussion of the PSM. 20 marks to aa jayenge PSM se. I have done other subject twice. Yes, if I just do your PSM yesterday and today and before high sessions, yes, they will be, yes, they will be benefited for sure. You revise those sessions, high session, you revise the previous year's question, previous year topics, and watch other revisions as well. You will get it, sure. Okay, anything else, guys? So we are just 28 days or 29 days away from the exams, so please open your channel and daily teach us something, okay. Yes, hopefully for now you watch Meduhub, okay, that will be great. Okay, any other doubts? I hope session was good enough, and do revise, give mock tests, give mini mocks, and solve questions as much as you can till the exams, and eventually you're gonna get this done, है ना? Eventually हो ही जाएगा. Be positive, that's the main thing, and most important, trust your efforts. You are working from last 3 months, you're working from last 5 months, so study that as well. Sir, OB-GYN discussion PYQs are already there, ma'am has taken, and but my high discussion of 3 videos of OB-GYN is already there, and general path on the Meduhub channel, you can watch that as well, okay. And if you need the PDF of the same, just ping me on the Telegram, I will share the PDF, okay. Thanks a lot, all the best, guys, okay. Remember, you give your best, whatever will be the result, that will be seen later on, okay. You never lose, okay. We never fail, we never lose, we either win or we learn, okay. So look out on your mistakes, look out on your weak points, weak subjects, and focus on them, okay. Don't be scared, okay. So guys, let's finish it here only. So all the best, God bless you all. Till then, take care. Allah Hafiz.